Hello everyone. I am Saif Awlad Thani, a pediatric intensivist at Royal Hospital Oman. Today I am going to talk about extremely important topic in biostatistics that you practice unconsciously every day in your clinical work. It is about probability. You may ask, is it really important for me as clinician to know and understand this topic? The answer is given by William Osler, who said, medicine is a science of uncertainty and an art of probability. So even if you don't want to know the details, you just need to understand the concept. To understand a lot of statistical tests used in analysis of data, you need to have some knowledge about probability. Actually, even if you are not interested in doing research, I think you have to know how to read and criticize published research in order to apply the best available evidence for your patient. And if you don't know very basic concept of probability, you will not be able to interpret p-value, which is used in most of the clinical trials. By the way, p-value is also a probability. In this talk, I am going to discuss very basic informations and calculations, and at the end I will give clinical examples to apply what I have explained. You may feel as clinician that you don't need to know the details of all these calculations. I agree with you, unless you are interested in health research methodology and biostatistics. But it is a good chance to just have an idea, and I will try to give clinical examples as much as I can. Funny example how to interpret or understand probability in wrong way. Probability can be defined in different ways, like how likely something is to happen, or the likelihood of an event to occur, or it is a measure of the degree to which an occurrence is certain or uncertain. This is an example how we apply probability in our practice, but without using numbers or calculators. 12-month-old infant presented to emergency room with cough and breathing difficulty. As usual, when we have such patient, we start thinking about differential diagnosis. What is the chance that this patient has pneumonia, or bronchiolitis, or heart failure, or asthma? We take more history, we do clinical examination, and we send initial diagnostic test according to the initial probable diagnosis that we have in mind. And after having more informations and some results of the test we sent, we shorten the possible diagnosis. Then we start to treat according to the most probable one. We always deal with uncertainty and probability. If I estimated the probability that this patient has pneumonia to be 80%, I will treat with antibiotic. If you think the probability that this patient has bronchiolitis is higher than pneumonia, you will treat conservatively with no antibiotic. One day I have admitted an infant with severe respiratory failure required invasive ventilation. The father has asked me a probability question. What is the chance he is going to die? It is a very difficult question when it comes to life and death, but we may use a score called Prism score to estimate the probability of death that is calculated based on multiple clinical parameters in the first few hours of admission. Don't tell me now that the probability is just a theoretical topic that does not have or does not do anything with clinical care. I think I have convinced you by now that it is a very practical topic in your daily life. Even when you wake up in the morning, you may ask, What is the chance that it is going to rain today? This is a probability. The calculation of probability is very simple. You just divide the event of interest to the possible events or outcomes that can happen. Let us have dice example. As you know, the dice is six-sided, numbered from 1 to 6. What is the probability of rolling 3 at one trial? We are interested of getting the side that has 3 dots, so that is our event of interest. Since the dice has 6 sides with 6 different number of dots, we have 6 possible outcomes each time, 1 or 2 or 3 or 4 or 5 or 6. So probability of getting 3 is 1 divided by 6. All possible outcomes that can happen each time is called sample space. Each time we roll the dice is one trial. If we repeat this trial twice or thrice or more, each time has its probability. Another example to emphasize the same idea. This bag contains different color of balls. Let us say total of 42 balls. If you put your hand in the bag with closed eye, what is the chance or probability that you will pull one orange ball? You divide the number of orange balls in the bag to the total number of balls, so 17 over 42. What about if you repeat this trial again and again? Does the probability change each time? Actually, it depends if you are replacing the ball that you pulled out or not. If you are not, the number of balls will change each time, so the probability may change as well. Can you think of any clinical example or a disease when the probability of having that disease will change after first occurrence? I have two examples. Having appendicitis again after appendectomy is 0, unless the surgeon decided to leave part of it to increase the probability of future appendicitis. The probability of getting chickenpox is different if you already had it before or not. The probability scale is from 0 to 1 or from 0 to 100%. The total probabilities of all possible events in each trial is equal to 1 or equal to 100%. Going back to the infant who came to ER and diagnosed with pneumonia, there are two possibilities. Either he will go home or will be admitted to the hospital. If we say the probability of admission is 0.7 or 70%, so the probability of going home is 0.3. The total probability is equal to 1. It is very important to know what you are talking about when you do your statistical analysis. It is not just a number. And that's why it is important to know the type of events while talking about probability. Events can be mutually exclusive or independent or conditional. Mutually exclusive means that the events cannot happen at the same time. One of them only should happen at a time. Example, gender, you are either male or female. If you flip a coin, you either get head or tail. The infant who came to ER with pneumonia either will go home or will be admitted to the hospital. So as you can see, those events cannot happen together at the same time. Independent events are events that are not affected by the previous events or events that can happen at the same time independently. For example, if you flip a coin multiple times, the event in the first time, head or tail, does not affect the probability of the second time, head or tail, and that does not affect what you will get in the third trial. Also, you can get flu and COVID at the same season independently. Having flu will not prevent you from having COVID. Those are independent from each other. Another example, the probability of having sickle cell disease child in each pregnancy is independent if sickle cell disease carrier parent already have sickle cell disease child previously or not. Conditional events or dependent events means the probability of an event is dependent in the probability of another event. The probability of having coronary heart disease is conditional if you are male or female, as it is more in male. The probability of getting COVID vaccine when you don't have enough doses for everyone is dependent if you are healthcare worker or not, or conditional if your age is more than 65 years or not. Knowing the type of events you have affects the way of calculation. Let us start with multiplicative rule. If you have event A and event B, the probability of both happening, probability A and B, is equal to probability A multiplied by probability B. Example, what is the probability of someone will get flu and COVID at the same season if data showed that 20% of the population got flu and 30% got COVID last winter? It will be the probability of getting flu multiplied by the probability of getting COVID. So the result will be 0.06 or 6%. Remember, these are independent events. This equation shows the calculation of conditional event. For example, what is the probability or the chance for a child to have headache if he has brain tumor? It is probability of headache and probability of brain tumor divided by the probability of brain tumor. Just be careful that probability of A given B is not equal of probability B given A. So the probability of having brain tumor in a child who has headache is different than the probability of having headache if the child has brain tumor. The other rule is additive rule. Again, if you have event A and B and they are independent of each other, that means they can happen at the same time independently, the probability of having A or B is equal to probability A plus probability B minus probability A and B. Why we subtract? Because we want the probability A alone or B alone, and we don't want the probability of them happening at the same time. So we need to exclude that chance. Example, the probability of having flu alone or COVID alone in the same season will be 35% if we know that probability of flu and COVID at the same time is 0.15. The additive rule is in mutually exclusive event is slightly different. So the probability of A or B is equal to probability A plus probability B. You don't need to subtract here, as we know mutually exclusive event never happen at the same time anyway. So the probability of A and B is 0. Additional probability rule is the probability of at least one event. Let us have a practical example. What is the probability of at least one successful trial if I did 5 attempts of central line insertion? The probability of at least one is equal to 1 minus probability of none to the power of number of trials. So if the probability of success in each trial is 0.4, the probability of non-success is 0.6, as the sum of probability in each trial is equal to 1. So the probability of at least one successful trial if I did 5 attempts is equal to 1 minus zero point 0.6 to the power of 5. The result will be 0.922. In other way, the probability of at least one successful trial if I did 5 attempts of central line insertion will be 92.2%. Let us end up with a clinical or practical examples to practice the probability. Three diseases A, B, and C are mutually exclusive. Disease A affects 1% of the population, disease B affects 1/2 of 1% of the population, and disease C affects 2% of the population. Sometimes a disease can present without the patient having any symptoms. 10% of the disease A patient have no symptoms, 5% of the disease B patient have no symptoms, and 25% of the disease C patient have no symptoms. Symptoms are present only when disease A or B or C is present. We have two questions. If a patient presented to your clinic and has symptoms, what are the probabilities that he or she has disease A or B or C? Second question, if a person has no symptoms, what are the probabilities that he or she has disease A or B or C? Let us analyze this question. So these diseases, A, B, and C, are mutually exclusive. That means they cannot happen in the same patient at the same time. So each patient either will have disease A or B or C. Then we are giving here the prevalence of these diseases. So the prevalence of disease A is 1%, disease B 1/2 of 1%, that means 0.05%, and disease C 2%. And the other information here that some patient will have the disease A, B, or C, but without symptom. That means that the disease is asymptomatic. And we have here 10% of patient with disease A are asymptomatic, 5% of disease B are asymptomatic, and 25% of the disease C are asymptomatic. And the other information that symptoms are present only when disease A, B, or C is present. That means if the patient has symptoms, he should have either disease A or disease B or disease C. Those two questions are conditional probability. What is the probability of having disease A given the patient has symptoms? What is the probability of disease B given the patient has symptoms? And what is the probability of disease C if the patient or presented patient has symptoms? In the second question, it is also the same but the opposite. What is the probability of having disease A if there is no symptoms? Let's say, for example, you did screening to the population about this disease, but they don't have symptoms. So what is the probability that they will have disease A if they don't have symptoms? What is the probability of having disease B if there is no symptoms, and so on? Let us organize the data that we have in a better way. So we have the prevalence of disease A and B and C in the population, which means 3.5% of the population, they will have either disease A or disease B and disease C. And by that we can say that 96.5% of the population, they will not have any one of these diseases. The other information, we have asymptomatic patient or asymptomatic people in each disease. For example, 10% of disease A people, they don't have symptoms. 5% of disease B people, they don't have symptoms. And also, we know that for disease C. For easy calculation, let us take the percentage mark. And also, I like to put things in table for easy understanding and calculation. So this table is representing the whole population. So in this population, we will have people who have disease A, we will have people who have disease B, and also we will have people who have disease C, and we will have people who don't have any one of these diseases, so without the diseases. Also, we will have patients who have symptoms, and we will have patients who don't have symptoms, asymptomatic, and we have this information here. So let us take disease A, for example. So in disease A, which is 1%, we have 10% of those 1%, they don't have symptoms. So by easy calculation, we will have this number. And if we have 10% of disease A patient, they don't have symptoms, that means 90% of disease A patient, they will have symptoms in this cell. So also by simple calculation, we will know or we will have this number. And you can do the same for disease B and for disease C. Those people who don't have the disease, without the disease, they don't have symptoms. So that's why I put it in this cell. Then the total of people who have symptoms and the total of people who don't have symptoms, it should be equal to 1 because we are dealing with probability, and as we said, the probability scale is from 0 to 1. Then the question that we have, what is the probability of disease A or having disease A if there is symptom? That means if you have patient who presented to your clinic with symptoms, what is the probability that patient will have disease A? Or what is the probability that he will have disease B? Or what is the probability that he will have disease C if symptoms are present? So we can do easy calculation as well. The people, or this is the total of people who have symptoms in the population. So the probability of disease A only, it will be division of this number to this number. And we can do that also for disease B and disease C. So in conclusion, and to summarize, the probability of having disease A if you have symptoms is 31%. The probability of having disease B if you have symptoms, it will be 16.5%. And the probability of having disease C if you have symptoms, it will be 52%. You can also do the same calculation if you have people or you have a person who doesn't have symptoms. So if you have, for example, a person who doesn't have symptom, what is the probability that he will have disease A? You can do also the same calculation as well. But the number here will be very low because most of the people, they don't have the disease. Another question for practice. You can pause the video and read the question and analyze it. Then we'll go to the result. So in this question, we have some information about the prevalence of the disease and also the accuracy of the test. Let us organize it in a table. So in this population, we will have people who will have the disease and people who doesn't have the disease, and people who are going to test positive and people who are going to test negative. Since we have the prevalence of the disease 0.1%, so in this column, the people who will not have the disease are 99.9%, so in this column. Since we know that the people who are having the disease will test positive 98%, so 98% of 0.1%, so we have it in this cell. And we will have people who will have the disease but they will test negative, so those are false negative, so 2% of 0.1%, it will be this number. In the people who doesn't have the disease, so There will be people who will not have the disease and they will test negative, so that means they are true negative, 98%, so 98% of 99.9%, so that's why we'll have this number. Then also we can calculate people who will not have the disease but they will test positive, so they are false positive, 2%. And by having these numbers, we can calculate the probability. So what is the probability of having the disease if you test positive? So we can calculate, we can do simple calculation. So we can divide this number from this number and we will have this number, which mean that the probability of having the disease if you test positive will be 4.6%. So as you can see, the percentage or the proportion is low because actually the prevalence of the disease is very low. But if the prevalence of the disease is high, the probability of having the disease if you test positive will be high. And you can do the other calculation in the same way. The third question is very interesting. You can pause the video and read it, then we'll go to the result. This is the probability of at least one event. So what is the probability for each person to see his or her name? It is 1 over 10,000. What is the probability of not seeing his name? It will be 9,999 divided by 10,000. So we can do the calculation. Probability of at least one is 1 minus probability of none to the power of 10,000. By doing this calculation, you will get this result, 0.6321. In other way, the probability of at least one person will see his name matching his seat will be 63%. I hope you enjoyed this talk. This topic may seem confusing, but believe me, I have spent very long time to understand the probability, and I couldn't understand it well till I start having questions for practice. Thank you very much.